Yes,
Okay.
people with COVID-19 have much higher viral loads than people had when they had SARS by about 1,000-fold. So that's one reason that this has gone out of control. Another is that with SARS, we didn't see anywhere near the asymptomatic transmission. In fact, it's not even documented. Whereas it's clearly documented that we have pre-symptomatic and asymptomatic transmission of this virus, which again facilitates spread, especially when the viral loads are so high. Moreover, we also know that with this virus, there's a high probability of someone who's recovered who's still shedding virus in their feces for over a month. And so that's another reason for the important hand washing, especially after going to the bathroom, because of this viral shedding. So children with COVID-19 continue to be no more than 2%, actually less than 2% of all cases of COVID. But obviously, as the numbers of cases go up, mathematically, that 2% is a much bigger number. So we're starting to see more numbers of children, even though that percentage is the same. In terms of the symptoms that we see in children, overall, they have lower levels of symptom in general. They're less likely to cough than an adult, and their fever is much less frequently noted. We only see fever in about 56% of the children that are sick with COVID. The headache, the cough, the fever, the sore throat are also less common, but those are the symptoms we see in children: fever, cough, sore throat, headache, muscle pain. Very uncommonly, we see the shortness of breath, which is actually fairly frequent. About 40 to 50% of adults have shortness of breath, whereas only about 10 to 15% of the children have a shortness of breath. So there are very distinct differences in how the children present, and a very high percentage of children who become infected with the SARS-CoV-2 virus have no symptoms at all. And those children are inadvertent individuals who can transmit the disease to more vulnerable members of our population, including their grandparents and great-grandparents and so forth. Unfortunately, there are going to be scammers all the time that dream up things that have nothing to do with the reality of life. There are actually 3 different kinds of 5G networks that are being stood up in different parts of the world. Some have short range, some have long range, some use different kinds of substances, but none of the different types of waves in order to provide the service. But none of the 5G has anything whatever to do with a biological agent. It has absolutely nothing to do with propagating a virus.